Hi everybody, it's Cookie Lou in Arizona. It's June 13th, Saturday morning, 9:30. I got my hair set in rollers today. Look there, my little pink and blue rollers. I'm going to have another MRI on my back this afternoon. I'm not a fan of going in that claustrophobic tunnel for a good 40-45 minutes, but it's a necessary evil to get a good image of what's going on in the body. I'm having my spine checked. It's the third MRI I've had since 2006 when I first injured my back. And I had an x-ray when I went to the doctor on the 29th of April. And he said, I still had the bulging discs and what have you, but there was some degenerative issues as well in there. So he wanted me to go to therapy, which I've been doing since April, and I'm continuing with therapy, even though I'm feeling much better. As long as Medicare is willing to pay for more sessions, I've booked them. Now that I'm gone through some therapy sessions, the doctor is wanting an MRI. He should have scheduled that a long time ago, and I fell through the cracks, so I got a call from his office saying that we really need to get that MRI scheduled. So I did that. I scheduled it at the place where I normally go near my home, and I'm going to do that today. Not a fan of that claustrophobic tube, especially when you're huge, and this is a center, an imaging center that has an extra large table. But I've regained weight, as as I've mentioned here before, and losing some, and what I've lost in order to be accountable, I'm regaining. I've regained. Yeah, I went on the scale this morning, and it's at 265. I mean, you can see it from my face. You can see it everywhere. For those of you who don't know my history, I had a VSG surgery in Puerto Vallarta, Mexico. Dr. Hoya, Armando Hoya, was my surgeon. I started out, my highest weight was 301 pounds, and that was with about 7 pounds of edema in my legs. That was the day that when I got on the doctor's scale and, look at that, Cookie Lou has hit the 300-pound mark. Congratulations. Up until that weigh-in with my doctor, I was probably pushing anywhere between 294 and 297. So after some water pills, I had lost about 7 pounds of water, and I think it was 94, 5, 6, 7, about 294. I went on the pre-op diet. I got down to about 279. And I had the VSG, had a very good surgery. Everything came out well. I didn't require a drain. I didn't require any gas medication. I didn't have any major pain at all. I was really an A-plus patient as far as the experience I had in Puerto Vallarta, Mexico with my surgery results. Then, of course, I realized I had to go home, and I had to do the work that was required to make the surgical tool work for me. The reason why I chose a VSG was because I wanted to choose an operation that had the least amount of problems. Lap band was too problematic for me from what I researched. There was a higher risk of gallbladder problems, strangulated bowel problems with the gastric bypass. Some people have had problems with that. Many have had their gallbladders removed. From what I was researching, I saw a lot of people that had VSG that were getting the same results that they got with the RNY without the problems. I don't know anybody that had a VSG that had any kind of post-surgical physical problems where they had to have, gallbladder operations or any other bowel problems. And there's no malnourishment problems with the VSG. So, I didn't have to take a whole lot of vitamins. I was pretty much still going to be me, everything is going to be intact plumbing wise, except my stomach was going to be cut out, and well, most of the stomach was going to be cut out and tossed in the trash. And so I went home, and I was Class A patient before and after surgery. I followed the rules explicitly to the letter, and I was having some fairly good results. I lost about 38 pounds the first what, 3 or 4 weeks, 5 weeks. I lost about 5 weeks. I lost 38 pounds, and I went into a stall for 21 days. That was really hard, and I stuck to it. And I says, okay, this happens, my hair's falling out, and I'm doing everything I'm supposed to do, food-wise, exercise-wise, and every day I got on the scale, and there was nothing, just plateaued. But I knew that was something that was likely to happen, and after about 21 days, it kicked in, but I wasn't losing the same amount of poundage that I was before the plateau, before the stall. I might have been losing 2-3 pounds a week, and now I'm losing maybe half a pound a week. Sometimes it would be 3 pounds in a month. So it really got slow. And I started kicking it up a notch. I started doing more exercises. I started drinking more water. I just started doing whatever I needed to do to try to get to move again. And it never really did. My total weight loss was 60 pounds. I knew that with the VSG, it usually will get you anywhere from 50 to 80% of your excess body weight reduced. And I guess it did its job. I lost 50% of what I wanted to lose. I wanted to lose about 120 pounds. I lost 60. But it wasn't enough for me. I was still obese. I'm still obese. And I started to, get a little frustrated, and started dabbling and testing the waters with, soothing foods. With me, ice cream is a demon. It's the biggest demon I have in my life is ice cream. And I started, having some ice cream. I'd have a piece of cake, or I'd have a sandwich. I'd be eating bread. Not that I did anything drastically but I was going back on carbs. And once you go, for me anyway, once you go back on carbs, it's bad news. And it doesn't take much of carb indulgences to really get me to puff up and to regain weight. And I gained 5 pounds this week. I don't know what happened. I don't know what happened, but I gained 5 pounds this week. I don't know what it is. I don't know. Maybe it's water. I know I haven't been to the bathroom as much as I had been in the past. Sometimes when you accumulate a lack of bathroom visits, you can gain weight. Water, other stuff. So needless to say, that's pretty much my history. I am very disappointed that I didn't reach my goal. That I even if I would have lost 85 pounds, I think I would have been happy. I just wanted to get into Wonderland. Even if it was 199 pounds, I really wanted to get into Wonderland. And the lowest weight I got to, with my high-low yo-yoing, with a few pounds up and down over the last 3 years, 3.5 years now, the lowest weight I got was about 235, 238. Which still isn't very good, but it was better than 297. Much better than 297. So I know that my physical problems, artificial knee, bone-on-bone knee joint on the other leg, the spine problems, sciatica on the right side of my body, and the neuropathy. I mean, there's just a lot of things that keep me from losing weight because of a lack of exercise. Last year, my exercise level has been pretty much zilch. Pretty bad. Last year I was doing great. I was in the pool almost every day. I was walking the track in the gym. I was on the bike. I was on the treadmill at home. I was just feeling a lot better. I didn't have any of these pain problems. And I've discussed that before, so I don't want to go into it too much. What I really want to discuss today is why people in this community, and just about everybody that I know, has had regains. So what causes that? What is it that we're doing up here that is keeping us from doing what we need to do? Is this something that we should expect to be a normal given? That once we have weight loss surgery, after a few years out, we're going to just be able to eat more food, change the way we eat, change the foods that we eat. I sat down here and I know that there were several of my friends this week that I listened to their videos, and they're all complaining about regain, disappointments with themselves because they regained, some gained a lot, anywhere from, excuse me, from 20 to 40 some odd pounds. Some even went into the, over 60 pounds, which is a lot, a lot. And even there's a young boy that I followed in Queens, New York. He started 500 pounds. He finally, after a big struggle, got approved for VSG. Within 1 year's time, he lost over 200 pounds. He could never get under the 300-pound mark. Hello? And he gained 80 pounds back. And he just did a video explaining about that. He's on the 40-day reset program, which is pretty much what I eat most of the time if I'm not off on a carb binge. Vegetables, lean meats, salads, no carbs at all, nothing white, no potatoes, not even sweet potatoes. It's a strict diet as far as just wiping out every starch known to mankind and every bad carb known to mankind. You don't eat it, plain and simple. And if you stick to that, you're going to lose good amount of weight, especially if you're a man. Women, it might be a little slower, as we all know. We don't do as well as men do in the weight loss department. So getting back to why we gain weight, I've been hearing the same stories from different people as far as what they're doing, how they're feeling what they're doing food wise, what they're feeling that makes them eat the foods that make them regain. And I was commenting, briefly. Sometimes I can comment way too long, and I decided I'm not going to comment long messages back to my friends when I want to support them, and I want them to know that I understand, because I have the same issues. I've never before allowed myself to get over a 14, 15-pound regain. And it was usually during the holiday time when I would just go hog wild and just, candy, ice cream, cake, cookies, Christmas cookies, pastries, things like that. This time, combination of troubles made me push up about 22 pounds. And now this morning when I got on the scale, I'm seeing an extra 5 pounds on that. 2, 3, 4, 5, 6. So it's close to 30 pounds, 27, 28 pounds. And I feel it and I look it, and I'm very upset with myself. So I sat down and I just kind of wrote out my feelings about what's going on with this regain thing. And I titled it, "It's a Mind Thing." And I'm going to just read it to you. I feel that after weight loss surgery, many patients get down to a happy, normal weight, and they continue to maintain their weight, give or take a few minor pounds. As time moves on and life as they live it continues to move onward, they, myself included, so I'm going to say we, suddenly realize that we can take in more food if we pace ourselves. I've heard that phrase many times from many people. They nosh more in front of the TV at night, and their choice of nosh is no longer a fruit or a hard-boiled egg. They take on a snack or two when they're out with friends and family, and before you know it, they are regaining weight. We don't like it, but we continue to not really pay attention because we're having too good a time eating things we have had to give up for such a long time. This is my story too, and I never even got close to losing the weight that I had hoped for. There comes a time when we just want to eat something we enjoy whenever we want to. It takes a long time for us to snap out of it and see the reality of the damage we've done to ourselves. I don't think we really understand what lifetime changes really are. What does that mean, really? It's not just a surgery, it's a lifetime of changes, a lifestyle change for a lifetime. Until we get to that point where we have to put that rule into serious practice, we're not going to take it seriously. We don't take it seriously. I know that in our head we know we have to do it, but in practice, when time starts to get further and further from that surgical date, we just kind of slip off the wagon. And I think, and I really believe from what I'm hearing from people, we're all doing that. We're all doing that. Lifetime changes means that we can never go back to the foods we love because they are so addictive we can't handle them. And giving up the foods we love forever is too long a time. After all, we say to ourselves, food is the biggest pleasure in life. How can I never taste my biggest pleasure again? Who will soothe me when I'm stressed or distract me when I'm feeling overwhelmed? So what do we do when we're feeling that way? When we're bored, when we're lonely, when we're depressed, when we're overwhelmed with work or family or finances are not the way we hope they would be, and we go back to the habits that we had before when these emotions hit us. We are emotional eaters. We are food addicts. We are sugar addicts. And what do we do when we feel overwhelmed? We dabble. We test the waters. We indulge ourselves just a bit to satisfy. Then before we know it, we've dived full force into old habits that got us into trouble to begin with. The trouble is called obesity. It's unfortunate that bariatric surgery does not include a brainectomy to remove that thing in there that won't cooperate with the lifetime lifestyle changes. That's a rule that we can never sway from. Because if we sway, we pay. So what is the moral of the story? What is it that's really happening here? What's going on with us? Now, you know, a lot of my friends out here lost over 100 plus pounds, and they were far from obesity before the regains happened. I was always in the obese category because I never lost enough weight. But there are a lot of people here that are still not obese, even though they might have gained, 20 or 30 pounds. They're still nowhere near the weight that they were when they had the surgery. And I've seen a lot of people, not only in this community, but just people that I know and seen, in the media that have had weight loss surgery that have regained, a lot of weight, never got to the huge number that they were on when they stepped on the scale at the surgery centers. They never got that big again. Nobody really turns into a skinny mini with this. Some of you have. Some of you are so strict, you don't sway not a molecule of anything that goes into your mouth. And you lose all the weight that you need to lose. You live with a hanging skin, and you're perfectly fine. You're happy with that. And I would be happy with that. I don't mind having hanging skin. I'd rather have that than the bulges that I have on my body. So how can I and others out there that keep suffering with this yo-yoing, this back and forth of regain? I mean, what is the moral of the story? Is it that we cannot beat the overweight game? No matter how hard we try, we find ourselves right back to square one again? What is this mind game we play called starting over again? Should we beat ourselves up when we falter and regain the pounds? Because if we look closely at our friends in this community, many of them have lived this story and regained some pounds. Is regaining a normal part of this weight loss journey? should we just accept that it is a natural part of the weight loss journey and that we have to just try to work harder at sticking to the rules so that when the mind game hits us, we don't let it get too far out of control? What is an acceptable number of pounds we are allowed to regain in the mind game? I guess that answer is up to the individual. How much are you willing to say, okay, life has put my emotions in a state of mind where I went back to the old comforts to soothe me. What the hell else can I do or reach for besides food to get me through the emotional stresses that I suffer when I go off the deep end? I know there's a lot of things that I have that interest me, but I really don't have the oomph or the finances to get up and do these things. No, the fun things. But I can go out and buy some ice cream. That I can afford to do. Financially I can afford to do that, but I can't afford to do that physically. And mentally, it's just putting me back into my sick in the head state of mind. I'm angry at myself for gaining the weight. I'm angry at myself for never losing the weight that I should have. The first year of surgery is the most important. For those of you who are on the threshold of that, please understand you must take it as 100% serious, and you just have got to work hard as possible to get off as much weight as you can during that first 10 to 12 months, because after that it gets harder. And I knew that. As I was going through the process, I kept hearing that from people that were several years out, how they did so beautifully, on VSG, RNY, lap band, whatever the surgery of choice was. They did so damn well, and I don't know. I don't know what we have to do. I know some of you out there have talked about going to therapy, try to clean out the cobwebs and get kind of on the straight and narrow again. That you're going back to, following the basic rules, which is what we all have to do. You're going to try to exercise more. We all know what to do, and we all know what we shouldn't be doing. And yet we're not doing what we should be doing, and we're doing everything that we know we shouldn't be doing. And the result is 20 pounds, 30 pounds, 60 pounds, 80 pounds more. Going in the complete opposite direction of what we promised ourselves right after that post-surgery video, that we were not going to do that anymore. I only wish to God that the surgery that I had, the physical condition that I was in after I had my surgery, still gave me the restriction that I had, that I would have maintained. I don't have that same kind of restriction. I certainly can't eat what I was able to eat when I had a 40-ounce stomach. But I eat more often during the day. It's not 3 meals and 2 snacks anymore. And it's not, gee, I ate a half a tuna salad, or I had a half a sandwich, or I had a small bowl of soup and I'm full. And I'm not even thinking about eating. And I'm never really that hungry anymore because I'm always throwing something in my mouth. I'm grazing all day long. And I find myself that the more I feel upset or bored or whatever, that brings me up out of the chair and into the kitchen, I've got to just do better with that. I've got to stop doing that. And I got to stop doing it forever. It is a lifetime change. And once I get that in my head and start putting it into practice without slipping back again and again and again and again, I'm never going to be successful. Because I know that even though the year is long up, that first year is long gone, I can still lose this weight if I put my mind to it, and if I put my body into action, and I make the right choices, and I just stay away from the cake and the sugar and the cookies and the ice cream and the bread, and stay away from starchy vegetables. And there are people in here, one person in particular, I'm going to tell you his name is Mark, and he lives here in Arizona. And he lost 500 pounds without weight loss. Well, he was 500 pounds, and he lost over 300 pounds without weight loss surgery. And that man has got such a strict regimen and his food plan. He cooks, he preps, and he eats a lot of food because he's got a full stomach, but it's all healthy food. It's not. He has never. He told me, Lucille, I never ever put one bad morsel of food in my mouth since I started this weight loss plan. I never didn't have a candy bar. I didn't have a drop of sugar, a drop of cake, cookies, ice cream, all the things that I used to love. I just cut them out 100%, and I never once swayed backwards. So therefore, he's still, thinner, and he suffers from, sagging skin. I mean, from 500 pounds to 200 and something is a lot of weight. But he does not sway. And there's a mental strength that some people have that I don't have, And I'm an intelligent woman, and I know a lot about life, and I have a great counseling mind for other people. But when it comes to this thing, and I remember Oprah saying that in between many of her diets, I don't know what it is with all that I have in my life and with all the intelligence that I have in my head. Why is that one thing that I can't seem to get control of? And even till today, somebody still asked her that question recently. And what is the one thing in life that you regret or that disappoints you about your life? And she said, the weight loss thing. And they said, are you still worrying about that after all you've accomplished and all the financial wealth that you have and all that you've done for the world? And that's still something that you regret not? That's a big thing? That's still a big thing for you? And she went, yes. It'll always be the one thing that I can't conquer and control is that weight loss thing. And I've gone through a lot of extremes, to get thin. I starved myself in that OptiFast for months and lost 67 pounds. And she says, and I've had trainers, the best trainers in the world, and I went to spas and weight loss farms and all that stuff. And I've lost the weight, regained it back. Lost the weight, regained it back, because I can't seem to get a grip on the thing in my mind that just won't let go of me. That food thing, that food addict thing, So it's just something that I think many of us have. And it's just hard. And we might go to our graves not conquering this demon that we have in this mind thing. We might never really conquer it. I guess we have to be content with that. I'm not saying that I'm never going to give up trying, that's for sure. And I'm certainly going to get rid of these 28, 30 pounds, whatever, that I gained, because, I was losing 6, 7, 8, 9, 10 pounds, and then all of a sudden, I started, getting lazy, getting lazy. I mean, I would be really on point and having my salads and fruits and not eating anything bad, and then all of a sudden I'm in the supermarket and I find myself going down the aisles I shouldn't go down, and I'm pulling things off the shelf that I know I shouldn't be pulling off the shelf. Then I take them home and I just totally go blank. I'm totally blank. Like, I know, okay, I'm having something I shouldn't have here, but I bought it, it's here, I'm going to eat it. Down it goes. And I'll be real honest with you, there's a good bit of time when I'm not ashamed to say it, because it is what it is, and I know I'm not the only one out there doing it, is I do, because I know my mouth wants it. My stomach isn't hungry, my body isn't really saying give me food, but my mouth is telling my brain, and my brain is telling me, mouth, I gotta have that that taste, that texture, that crunch, or whatever it is. I gotta have that. I gotta have it now. I gotta have the chips with the melted cheese on it. I gotta have some chocolate. I have to have ice cream. I have to have. Oh my God, they got that big cake on sale for $4.99. It's one of my favorite cakes. I can't let that sale, that deal fly by me. And I go out and buy the cake, and in 3 days, the cake is gone. So what I find myself doing, and embarrassing as it is I will chew, put the taste that I need to have in my mouth for that point in time, and I'll spit it out. I'll have a spit cup, and I'll chew it, and I'll get the texture, and I get the whatever I want out of that, and then I spit it out. So even though I say, gee, I bought a pizza the other day, and in 2 days I ate nothing pretty much but, a couple of slices here and there, but I didn't eat the crust. I would chew it, spit it out. Eat some of the topping maybe and then spit it out. So, I'm buying food and I'm throwing it in the garbage, literally. But at least I feel as if I'm satisfying whatever I need to satisfy for that moment. But I'm not ingesting it. But in spite of that, people, I'm gaining weight. Because as soon as you put something in your mouth, that's the first step in the digestion system. And all the sugars and carbs and whatever that's in that food that you're chewing in your mouth is going into your tissue. Some of it is going down your throat. It's going through your, the tissue in your mouth, and it's absorbing into your bloodstream. And that is going to make you gain weight. And I gained 5 pounds doing a little chewing and spitting over the last couple of weeks. If I didn't spit it out, I probably would have gained 12 pounds. But it's a sickness in the head. It's this mind thing that we're trying to, okay, how can I satisfy the mind thing without gaining weight, without really skipping the rules that much? Can't do it. Can't do it. So I know I'm never going to be skinny. I know I'm never going to have a revision surgery to help me. This age, I don't think anybody would even do it, pushing 70 years old. I don't think anybody would even do it. Look, I just got turned 69, and I'm saying I'm pushing 70. Well, I guess I am. It's been 6 months since I was 69. February, March, April, May, June, yeah. Oh, it's almost July. Time does march on. And I really want to feel, I want to end this life of mine knowing that at least I got a decent grip on this mind thing, that I didn't let it get the best of me, that I did control it most of the time, and that if I did go on a bender, binge, or whatever you want to call it, I corrected it after a couple of days rather than a month or two. So I don't know. I know I've been babbling on, and I probably won't even post this because it's way too long anyway. But my friends out there that are suffering with this, you have my love and my support and my understanding. And let's just hope that all of us can reach a point in time in our life before it's over, and it is going to be over sooner than we think. That we can kind of get a grip on that and at least get to the point where we're comfortable enough with our bodies, where we can function better and we're healthier physically, internally, and we look decent when we put on our clothes, and we're happy with what we see when we look in the mirror. I just want to be happier when I look in the mirror. I want to feel like the best of what Lucille could be in this life is projected in that image. And I guess that's all I have to say today, my friends. Just know that I love and support all of you, and I understand what you're going through because we all have the same story about the mind thing. Bye.